Generating nearly $33 billion in underwriting gains in the most recent four-year period, the Managed Medicaid segment posted a $3 billion underwriting loss in 2024. Here to discuss a new AM Best report is Jason Hopper. He's Associate Director of Industry Research and Analytics at AM Best. Jason, welcome. So great to see you. Thank you so much for joining us.
Thank you, Lori.
Jason, the report notes a mismatch between pricing and risk profiles as one of the reasons for the underwriting results. Can you explain that dynamic?
Sure. So that is definitely a driver of a deterioration in results. Medicaid has been a profitability driver for at least a decade, more so than that. So it has been a steady stream. So what happened is, in reaction to the coronavirus pandemic, the government instituted a public health emergency whereby enrollees could not be kicked off Medicaid. So this public health emergency was lifted in the early part of 2023. And so you had all of these healthier people that have become on the Medicaid rolls over a number of months, right? So the way pricing works, which is typically done in advance of the following year, so once the public health emergency ended, all of these people started getting kicked off the rolls. These generally were healthier people that have generally better utilization, not as much usage of care, right? So you had all these healthier people, and when determining rates, it's usually a 12 to 24 month back year window. So all of these healthier people are included in the rate setting and their utilization, right? Which is kind of artificially pulling down the Medicaid utilization. So with that, pricing is probably less than what it should be. Right now, as all these members are getting kicked off, as the public health emergency ended, the rates are lower than the actual risk profile of the actual Medicaid population.
How about specialty drugs? How are they impacting the results?
Yeah, so again, in response to the pandemic, in 2021, people weren't going to the doctor nearly as much. Utilization wasn't quite as high. After the pandemic, you kind of see more home health issues. You see behavioral health care utilization, as well as specialty drugs and GLP-1s, which are all driving up the medical trend, medical loss ratios, as well as acuity and the medical cost trend as well.
With the One Big Beautiful Bill Act passed, do you expect these pressures to be long-term in nature? And what about for ACA participants?
Yeah, so the mispricing issue will probably bleed into 2026, potentially 2027. But the One Big Beautiful Bill has some other headwinds that could face the industry as well. You have redeterminations. Medicaid work requirements are being implemented in the coming years as well. Eligibility requirements are going to be more frequent than they historically were. And some of the cost burdens are being shifted more so to the states than the federal government. So those three things combined, I think, are going to contribute to some additional headwinds over the coming years, 26, 27, maybe 28, which is when some of these impacts start to take effect.
Jason, always a pleasure. So great to see you. Thank you so much for joining us.
Thank you, Lori.
That was Jason Hopper, Associate Director of Industry Research and Analytics at AM Best. For AM Best TV, I'm Lori Chortis.